डॉक्टर आरसीटी के बाद रात भर दर्द होता रहा. Sounds familiar? Yeah, been there. And if you're someone who's ever left a tooth open intentionally, welcome to the club. Hi, I'm Dr. Palak, and today we are talking about a very controversial but super practical topic: open versus closed dressing during root canal treatment. Yes, I do keep teeth open sometimes, and no, it doesn't mean I'm lazy and careless. It means I know when to let nature help me out of it. Let's break it all down with logic, laughs, and lots of real life tips. Most RCTs go in three sittings. Day 1 is excess opening and drainage. Day 2 is cleaning and shaping, BMP. Day 3 is obturation and seal. Sounds neat, but in real life, pus is flowing, the patient is swollen, they came in late, and you haven't had your dinner yet. This is when open dressing makes it grand entrance. Let's talk about it. Open dressing basically means you access the tooth, remove pulp, cannot dry completely, so you leave it open, not sealed, no medicament, just raw and open to the mouth. Sounds dangerous? It can be. But done right, it can also be a blessing, especially when there's continuous pus drainage, patient is in severe pain or swelling, you don't have time to irrigate fully. ये एक ऐसी चीज है जो या तो पेशेंट की जान बचाएगी या आपका नाम खराब करेगी. So here's how I do it. Rule number 1 is I only leave open if drainage is active and the canal is soaking wet. Rule 2, never leave it open for more than 48 hours. Rule 3, I tell the patient very clearly कि सर मैम आपका दांत अभी खुला हुआ है, कल या परसों आपको वापस आना ज़रूरी है और खाने के बाद ब्रश करिए, खाने का कुछ भी टुकड़ा अगर अंदर गया तो आपको पेन हो जाएगा. So my method is to open the chamber, drain with paper points or suction, no irrigate if it can't flow out, place dry cotton loosely, that is optional, and then leave cavity open, no seal. Then educate your patient, tooth open छोड़ा हुआ है, and here's the dark side of open dressing. Food lodges inside, smells like sewer. Saliva enters, new bacteria enter. Patient forgets to return, infection worsens. You seal it later, pressure build up and flare up. Tooth open रह गया तो patient का दर्द भी open invitation बन जाता है. That's why I make sure my assistant follows up next day via call or message. What is the bonus tip? If patient can't come next day, don't leave it open. Drain as much as possible, place calcium hydroxide and temporarily उसको seal कर दो. If swelling is subsiding, drainage has stopped, then I go for irrigation with sodium hypochlorite, dry canals completely, place calcium hydroxide and then seal with temporary restoration. बन ड्रेसिंग में असली मैजिक होता है, बैक्टीरिया बंद, पेन बंद and Google reviews fabulous. Open or close, both have their place, but don't be lazy, don't be scared, just be clinical. If drainage is active, open for 1 day max. If not, clean, medicate, seal and chill. This was Dr. Palak sharing the real behind the scenes of endo life. If this helped, hit like, subscribe and comment. And thank you very much for your time.